I'm going to talk to you today about an integrated care pilot project under the heading of tobacco. The project is called Empowering Cancer Care, Optimising Stop Smoking Brief Interventions Throughout Cancer Treatment. This is a project between the Regional Cancer Services in the South East and HSE Health Promotion South East Community Stop Smoking Services in the South East. So just to give a context to this project, when applying health promotion to all levels of cancer prevention, as health promoters, we are very familiar with our primary prevention for a whole population. You'll see that we have the Making Every Contact Count logo to the right-hand side, where we look at modifiable lifestyle risk factors. We also have the NCCP, Reduce Your Risk, and all of the cancer-specific lifestyle risk factors that we target messages and our activities at general population and also at those at risk. Secondary prevention includes people at risk of health problems. We have National Cancer Screening Service, which is bowel, breast, cervical cancer for the general population or whole of population. But a big part of our cancer prevention health promotion work is around early diagnosis. So knowing the signs, finding cancer early, huge part of how we promote our secondary prevention activities. Now, this project I'm going to talk to you today about is very much sitting in the tertiary prevention area. It's targeted at people who have disease, so people already attending cancer services and have been diagnosed with cancer. So just to have some background, recent research published by UCD in the last 2 years has shown there is a disproportionate rate of smoking cessation amongst cancer survivors when compared to the general population. Research shows that cancer patients are less likely to be offered brief interventions for smoking cessation or referred to smoking cessation services while attending cancer treatment, as they would be if they were in other parts of the hospital receiving services. Staff barriers to interventions around stop smoking have been identified in research. Within this research, cancer patients themselves identified that they want healthcare professionals to ask and discuss smoking cessation, with particular emphasis on short-term benefits. Research also shows both immediate and longer-term benefits of stopping smoking for cancer patients, from diagnosis right through treatment to surviving or living with cancer. So some of the staff barriers to delivering stop smoking interventions. Well, smoking amongst cancer patients leads to poor outcomes, yet many patients continue to smoke. Research identifies both patient and staff barriers to stop smoking after cancer diagnosis. So addressing any identified staff barriers would be an important step to addressing inequalities for cancer patients' access to stop smoking support. So the identified staff barriers were stigmatizing patients. Staff didn't want to feel they were stigmatizing their patients in any way, especially with a cancer diagnosis. Inadequate training in smoking cessation, perceptions that such discussions are not appropriate, likely to be ineffective, and referral pathways. So this project is about research to practice, and the focus is on the staff barriers. So the aim of the project is using a knowledge transition framework and national clinical guidelines to underpin the importance of these stop smoking brief interventions. This project will assist staff that want the best outcomes for their patients to integrate a care pathway to the already established community services that can provide specialist stop smoking support. So the objectives of this project is taking research to practice with a focus on staff barriers. So objectives are to provide cancer patients who smoke with equal access to stop smoking supports with the right care in the right place at the right time, to empower staff to optimise brief interventions for stop smoking with their patients throughout all stages of cancer treatment, diagnosis, treatment, right through to survivorship, to provide easy access and direct referral for the acute pilot site to the community stop smoking services, and to establish and integrate a collaborative professional relationship between the acute cancer services and community stop smoking services here in the South East. So looking at other staff barriers, the perceptions that such discussions are just not appropriate. Well, staff are not always aware of the National Clinical Guideline number 28, which is around stop smoking, which says that all healthcare professionals should ask and document individual smoking behaviour, but also says that professionals should advise all people who currently smoke about the harms of smoking to themselves and others and the potential benefits of stop smoking. Looking at benefits of stopping smoking for cancer patients. Benefits include better treatment outcomes, fewer treatment-related complications and toxicities. So that means lower risk of infections, fatigue, lower risk of heart and lung problems from treatment. Faster recovery from treatment, and this is especially true after surgery. Reduced risk of reoccurrence of the cancer. Fewer new second primary cancers. Better survival rates. And lung cancer mortality is lower with decreased smoking. And smoking-related complications have been shown to decrease by up to 19% per week after stopping. So how this project will work? The project is underpinned by research, clinical governance, and a quality improvement structure. Steering group established, staff engagement, a tailored education intervention be designed, pilot site champions to sustain the momentum of the project, new direct electronic referrals to local stop smoking services, and a review with recommendations and the potential to replicate this project towards the end of 2025. So that's where this project is at. It's a very exciting project, and thank you for the opportunity to share this with you.